The working principle of a BiPAP, bi-level positive airway pressure machine, involves delivering two different levels of air pressure to assist with breathing. The machine supports individuals who may have difficulty maintaining adequate airflow during both inhalation and exhalation. Here's a breakdown of the key components and working principles. Pressure levels. BiPAP machines provide two distinct levels of air pressure during the breathing cycle: inspiratory positive airway pressure, IPAP, and expiratory positive airway pressure, EPAP. IPAP is the higher pressure delivered during inhalation, helping to open the airways and assist with the intake of air into the lungs. EPAP is the lower pressure applied during exhalation, preventing the airways from collapsing and maintaining an open passage for the next breath. Prescription settings. The specific pressure levels, IPAP and EPAP, are prescribed by a healthcare provider based on the individual's needs. This prescription is determined through sleep studies, respiratory assessments, or other diagnostic tests. Customization. BiPAP machines are customizable to meet the patient's requirements. The settings can be adjusted to provide the right balance of pressure support, making it more comfortable for the individual to breathe. Trigger mechanism. BiPAP machines are equipped with trigger mechanisms that sense the initiation of inhalation. When the machine detects that the user is starting to inhale, it responds by delivering the higher IPAP pressure. Conversely, during exhalation, the machine switches to the lower EPAP pressure to support the patient's breathing and maintain an open airway. Humidification, optional. Some BiPAP machines include a humidification component to add moisture to the airflow, preventing dryness in the respiratory system. This can enhance comfort and adherence to therapy. Monitoring and data recording. Many BiPAP machines have built-in monitors that record data related to usage, mask fit, and therapy effectiveness. This data can be valuable for healthcare providers to assess the patient's progress and make any necessary adjustments. In summary, the working principle of a BiPAP machine revolves around providing personalized dual-level positive airway pressure to assist with breathing. This targeted support is especially beneficial for individuals with conditions such as sleep apnea, respiratory insufficiency, or neuromuscular disorders. CPAP differs from bi-level positive airway pressure, BiPAP, where the pressure delivered differs based on whether the patient is inhaling or exhaling. These pressures are known as inspiratory positive airway pressure, IPAP, and expiratory positive airway pressure, EPAP. A BiPAP machine is the most commonly used non-invasive form of NIPV. The machine works similarly to a CPAP machine in that it delivers a constant level of PEEP, usually 3 to 12 mmHg, but it also provides positive inspiratory pressure, usually 5 to 25 mmHg, when the patient initiates a breath. The machine pressurizes the air to a higher level than the air in the room, and so it helps a person to take in oxygen and exhale carbon dioxide. This helps them to breathe more easily, either while sleeping or when experiencing a flare-up of symptoms. Will removal of BiPAP cause shortness of breath or pain? Patients may develop breathlessness, gasping, difficulty breathing without BiPAP, but may be managed by repositioning. Oxygen may offer some further symptom control, for example, given to patients via face mask. However, pain is rarely experienced. Generally, patients can remain on the machine for up to 2 hours. However, it is important to note that the length of time a patient can stay on a BiPAP machine can vary depending on their individual health and medical history. Initial settings on a BiPAP machine usually start around 8, 10, and can go up to 24 cmH2O for inhalation and 4 up to 20 cmH2O for exhalation. With BiPAP, the inhalation pressure must be higher than the exhalation pressure so that the bi-level airflow can be maintained. It pushes pressurized air into your lungs, that opens them and lets you get the oxygen you need, which can lower your chances of things like a heart attack. A BiPAP machine is about the size of a lunchbox. A face mask, nasal mask, or nasal plugs are attached to the machine by a tube. How many hours should I wear a BiPAP machine per day? To benefit from a BiPAP machine, you should wear your BiPAP equipment for at least 4 hours per day. But it could be better if you wear it for the entire night during your sleep. You can also wear the BiPAP machine in the daytime if possible.